Everybody, and welcome back to the Morning Blend from Gulfstream Urology. Dr. Alejandro Miranda Sousa, good to have you here.
Hi Bill, how are you?
Good.
Excellent.
And you're here to talk about kidney stones.
That is correct.
Which those are two words that you hear a lot in your office.
Correct.
What exactly is a kidney stone?
A kidney stone is a small mass made out of crystals. It forms usually in the kidney levels, and they can cause symptoms or not. And they vary on shapes and components quite a bit. They usually are many risk factors that form stones, and I consider, the literature considers this to be a condition of habits, usually habits that don't go very well, and the most common cause of this will be being chronically dehydrated, not drinking enough fluids.
So drink more water and you will decrease your chance of having kidney stones.
Correct. The crystals, the closer they get together, the more chance that they will stick to each other. So the more fluid you drink, the more urine you will produce, the crystal will be growing apart.
You brought some great pictures that we want to show.
Yeah,
This is what could happen if you don't drink enough water. Take a look at this. Kidney stone. Wow.
Yeah,
that's about an inch, a couple of inches.
That's a centimeter.
Centimeters,
so
I'm
it's half an
sorry.
inch. That's half an inch.
Half an inch. But look at the sharp edges and how it protrudes.
Absolutely,
and kind of
absolutely. That was a typical stone. That stone was passed by a patient, so passed on its own. So stones could be as big as a centimeter in pass. Obviously, the bigger they get, the more difficult to pass they get. And there are some other shapes and forms, and you can see that one is a solid concretion of many crystals. The next picture will show you a bigger stone and multiple small fragments that were passed after a surgical procedure.
And we'll take a look at the next picture now.
You can see the bigger ones on the left, and then smaller ones on the right. And sometimes after a surgical procedure or shockwave lithotripsy or a surgery through the back to get to the kidney, you can get pieces like this. You can get in one, or ideally they should pass like small fragments on the right.
This is like a solar system, a universe of kidney stones.
Very true, very true.
All right, and next we'll take a look at what you brought us next.
And those are different shapes. And you can see one on the upper left is very spiny, pointy, and they usually scratch the inside of the ureter and kidney and bladder. So actually the patient will present with pain and blood very commonly. You have some other stones, and the black one there is
that looks like a torture device.
It looks like maybe how it feels. It feels like something is really spiky.
I gotcha.
And usually some of the stones, even small, like 1 millimeter, 2 millimeters, could be like a torture. Even though when you pass it, you see that this, like a grain of salt, is causing this much pain, and it usually does. Sometimes you have stones. In the next picture, you will see stones out of the bladder, and those are like pebbles from a riverbed. You see how
polished almost.
Shiny and polished they are. Those are usually because they are rubbing against each other, and you can have many stones. That was one patient that I removed stones out of his bladder, and he was having obstruction, urine was not flowing well. So that's one of the other risk factors, is not the inadequate flow of urine. So one of the reasons why we have patients have a lot of stones could be an obstruction. So we need to check into a few things. And usually patients that have one stone, they have a big chance of having a second and a big chance of having a third one. So the risk factor is around 15% for a patient to have another stone within a year, close to 35% a stone within 5 years, and 50% will have another stone within 10 years.
So if you've had them, it increases the probability of
having a recurrent stone. So it's important that even after the first episode, we try to look for the potential causes. Causes include poor diet, meaning that reaching in animal protein, the urine could be having a lot of concentration of calcium, so eating a lot of salt, that's also not good for your blood pressure and retaining fluid. That can actually help the urine to have more calcium. That is not good because you have a calcium ready to stick to each other. So it's important to look into what the cause of the stones are to try to prevent them. In our practice, we try to look for the causes. Not only treat them, obviously sometimes we need to treat them, but obviously trying to prevent stones, because if not, they're going to be a lifelong condition for these patients.
And you look for them with x-rays, which you brought a few
exactly.
examples of.
There are some x-rays that we were able to see multiple ways to find stones. The most common one is a KUB. We call that kidney, ureter, and bladder plain film. You can see stones, little white dots next to the spine. The next one is very obvious, and you can have stones like occupying pretty much the whole kidney. And you can see on the right side kind of a mold of the inside of a kidney. On the left, you have also multiple stones there. But the most efficacious way to find stones, because plain X-ray will find stones rich on calcium, will be with a CT scan. The CT scan is commonly done on the emergency room, and you'll see, and like in this place, a bright white stone. It's very, catches pretty much 99% of the stones on CT scan. So it's very helpful and location, and you have one there that is ready to go into the bladder. So it helps us quite a bit to diagnose, kind of tailor the treatment specifically for the patient and advice, because based on the size of the stone, the chance of passing will be present. So prevention is drink a lot of fluids, enough to have clear urine, drink plenty of lemonade citrate.
Lemonade
helps quite a bit. Yeah, lemon or lime juice, not orange juice, just lemon and lime, helps coat the calcium so it will stick to each other. Decrease the amount of salt in your diet, and decrease the amount of animal protein, because uric acid is a very common component of stones. So multiple stones, treatment varies based on the size of the stone, location of the stone, composition of the stone. So you need to be seen by a urologist usually to have some workup and plan the treatment for the future.
And that's what you do. Thank you so much, Dr. Alejandro Miranda Sousa.
Thank you.
Glad to have you with us. If you have any questions for him or about 21st century oncology or Gulfstream Urology, go to our website. It's fox4morningblend.com.
All right, and don't you go anywhere. We've got a check of your Fox forecast.